Well, these guidelines come out in the context of a history of previous guidelines. The first one came out in 1992, and then there were more in 1998, which were not very much changed. And so we've been long overdue for another set of guidelines. But there's a certain urgency, and that's because there are a lot of overweight and obese kids out there, and people are concerned about that. We have had guidelines to treat children as young as 10 years old with statins, and we generally reserve using a medication at that young age for somebody who has a very severe elevation in LDL cholesterol. However, the recent AAP guidelines, the American Academy of Pediatrics is recommending that we could even go as young as 8 years old. And the reason for that is that there are some kids who are born with this genetic predisposition to high cholesterol, and they're likely to have events quite early in their 20s or 30s. And so for those kids, starting a medication early can, we think, really reduce their risk for heart disease. There have been recommendations for a long time, using those previous guidelines, to do checkups every 5 years in certain groups that have higher risk. But I think that not everybody has implemented those fully, and there have been a lot of questions about how to do it. There have been concerns about the previous way of screening, and so not everybody has done that. There are a number of different types of cholesterol, and when you measure a total cholesterol, that is a combined sum of your LDL, which is your bad or lousy cholesterol, and then your HDL, which is your heart-healthy cholesterol. And it also has an amount for triglycerides, which are another way that your body kind of transports fat around. So your good cholesterol is your HDL, and that seems to reduce your risk of heart disease. Kind of goes up and cleans out your arteries a little bit, or picks up some of the problems that can occur from your bad cholesterol, which is your LDL. I'm certainly seeing more children who have been picked up because of this increased screening, and the screening that has increased even before these guidelines is related to pediatricians' concern about overweight and obesity. And then the second issue is that overweight and obesity does increase your risk for having high cholesterol levels, high cholesterol levels, and then other subsets of cholesterol that are elevated. All of us are focusing really intently on diet and exercise as the first-line treatment for children with high cholesterol. And that's because you can see a lot of improvement if you really make modifications to your diet and your activity profile. Studies show that about a 15% decline can be seen in cholesterol levels, but my experience is if there are a lot of changes to be made and a family is properly supported, then they can really make substantial inroads, even more than that. And if diet and exercise don't work, then we sometimes need to go to a medication. Well, if cholesterol is left untreated, we very rarely see any short-term effects, so nothing bad is likely to happen during childhood for most of the kids that we see. However, we're worried about their risk for heart disease in the future. And it used to be that we were worried about cardiac events happening in kids who ultimately wound up to be in their 40s or 50s, but now we have a greater sense of urgency because of this obesity epidemic. And so if a child also has overweight and high blood pressure and diabetes, then something could occur in their 20s or 30s. And so that's the range that we're really worried about.